I think. All right. Well, happy Friday, everyone. I'm gonna give just to be a little slow about it, just let people come in and join. Brandon Garrett here. It's Friday, and so the National Minority Equality Forum. We host these webinars, and before we start, the most important announcement of the day is we want to say everybody to wish Ashley Hill a happy birthday. It's not today, it's this weekend, but she was off for her birthday, but she just wanted to make sure this webinar went well. And she joined us. So I really appreciate her in general, but her for this specifically today. So happy birthday, Ashley. We want to make sure we say that at the top of the hour. And then we can get on to the business of the webinar today, the ripple effect, changing perceptions through vaccine advocacy. As you know, I mean, with our incoming administration, vaccines are going to be even more important and very necessary to protect. And the team at SHC has been working on in vaccine advocacy for some time now. And I think they're the experts here and they can help get the ball rolling there and make sure more people are even more aware, better aware of the need for vaccines and how helpful they are for our overall public health. And so Chinnie on our team, as you know, has the director here, has been leading an outreach and the programming there. And I think she's going to have some of the advocates that she works with talk about the ripple effect of it. So if without any further ado, I'm just going to go ahead and turn it over to you, Chinnie.
Thank you so much, Brandon. And thank you everyone for joining us today, especially my esteemed panelists. I'm really happy to have you here as we talk about this really important event. Interestingly, this week also happens to be the National Influenza Vaccine Week. Yay! So I think this is the best time to be having this conversation as we can talk about vaccines, especially the flu vaccine this week, how important it is, how important it is to continue to advocate for folks to get it, especially if they're 6 months and over, how folks can get access to it, and all things that can make the flu vaccine and all other vaccines, the uptake of those vaccines more accessible and easier. So happy flu vaccine week, everyone. And we hope that if you haven't already done so, that after this webinar, you go get your flu shot. All right. I am really happy, like I said, to be talking with you today about this important topic with a team of excellent, experienced panelists. And each of them will get a chance to tell you what they do and who they are. And so without further ado, I will be handing off over to you, Ms. Carey, to just briefly introduce yourself, where you're from, and how you come to this work with us.
Okay, so hello, my name is Carrie Davis. I am in Albany, Georgia, which is in the southwest portion of Georgia. So a little bit closer to Tallahassee, Florida, and Dothan, Alabama. So we're kind of in that little corner right there. And I work with Mount Zion Baptist Church in Albany, Georgia, where we're also a part of a coalition of churches that work together to promote health equity within our region. So I serve right now as the grants manager for this program and project manager. So that's kind of who I am and where I am. And you'll hear a little bit more from me a bit later.
Awesome. Thank you so much, Ms. Carey. Ms. Phyllis?
Yes, good afternoon, everyone. My name is Phyllis Summers Dudley, and I'm glad to be a part of this team. And to let you know, I am a retired network engineering manager. I'm also a licensed healthcare provider. I'm trained in Alzheimer's and dementia. I'm also president of a nonprofit organization called Central Gateway Community Development Corporation. And basically, we work a lot of with the communities, and I partner with hospitals and senior facilities to work with individuals on the vaccination shots. So whatever I can do to help, I'm here.
Thank you. Thank you, Ms. Phyllis. Glad to have you here.
Thank you.
Vivian, we don't see you on the screen. Are you still there, Ms. Vivian? Okay, seems she may be having technical difficulties. She was here right a few minutes ago, so I'm not sure what's going on. But while we wait for her, I'm just going to say some things. Today's topic is the ripple effect, changing perceptions through vaccine advocacy. And really, we're hoping that after our team of community experts share with you their deeper understanding of their efforts, that you will be inspired to take action in your communities to not just speak for yourself with regards to vaccines, but also speak for others or encourage others to get the vaccines. So as of today, I looked at the CDC data, and as of today, it looks like the flu vaccine activities are still very low or moderate, and that the map shows that what's going on is that there's a slight increase for children, but for adults it looks like it's not going too badly. Of course, there are some states that are beginning to show moderate signs, including Puerto Rico, Hawaii, and a few other states. I would like to encourage that everyone get the flu shot. I'd like to encourage that everyone get the flu shot so we can keep this map looking as green as possible. We know that with the holiday seasons coming along, that it's very likely that with the big gatherings and family unions, that folks that this could change within very quickly. And so we're encouraging today that folks get the flu vaccine so we can keep this activity low. Ms. Vivian, I see you on the screen now. Do you want to take a minute to introduce yourself before we jump right into the topic? We don't hear you, Ms. Vivian. You're on mute.
I do apologize. I don't know what happened to my computer. You know, old people and technology don't go together. So my name is Vivian Clark. It was Armstead. I recently got married. It's now James. I'm gonna have to correct that. But I hail from Columbia, South Carolina, at the Trinity Baptist Church under the direction of the Reverend Dr. Thurman Boynes Jr. I'm chair of our health and wellness ministry, and I have about 28 years in public health.
Okay, we don't hear you anymore, Ms. Vivian.
4 years. See, I don't know what's wrong. Anyway, we can continue.
Okay, thank you. It's glad to have you here, and we hope that you're able to share your insights with us. All right, so I'd like to begin this topic today by defining vaccine advocacy, because I want us to make sure that we're all on the same page with what we understand by vaccine advocacy. And I'd like to read the best definition that I found. It says that vaccine advocacy is the active support and promotion of vaccines to increase public awareness, understanding, and acceptance of vaccination. It involves educating individuals and communities about the benefits of vaccines, addressing misconceptions, and encouraging people to protect themselves, but also others from preventable diseases. That being said, let's talk about why this issue continues to be important, not just for ourselves, like the definition highlights, but for our communities. So I'd like to ask my panelists one after the other to tell us a story in 10 minutes about a community vaccination event that they successfully, or campaign that they successfully hosted, and why they think it was effective, why they think it was successful, and if there are any lessons that they took from those events. Ms. Carey, I'll ask you to start.
All right, that's not a problem. But yes, so we have had several different initiatives that have been going on. And one of the things that I mentioned earlier was the fact that we are a part of a coalition. So we have about 30 churches that are within the Albany-Dougherty County area, but then we also serve some rural areas that are kind of our surrounding counties. So some of those areas do not have access to a healthcare provider. So really their health department is the only source of vaccinations for them. So with our coalition of churches, because we have so many minorities that do attend churches and that will listen to their pastors. And so we encourage those churches to go out to advocate for those vaccinations and encourage people in their congregations to go ahead and get vaccinated. We like to hear that message coming directly from the pulpit, so that they know that that's a trusted voice that they can rely on. And again, with our health departments getting their budgets cut and not being able to do a whole lot of marketing, hearing it on Sunday morning is key to get to those rural areas that we serve here. So in that effort, we have reached out to some of our coalition members to host vaccination events. So to date, we've held 2 of those events where we have offered incentives for people to come in, get their vaccinations done that day. And we are not just offering flu vaccinations, we've also offered COVID vaccinations, RSV, and a couple of others that were available through our partnership with Walgreens, so that people will come in and get those vaccinations done. So it's not just you coming and getting the vaccination, you can leave with a little bit of money, which is kind of important this time of the year because it's the holiday season. So any little bit or any amount does help. So we were able to offer that at the 2 events that we've held so far. But we've also partnered with our monthly elevation events, and these are men's prostate events. So we do prostate testing at these events once a month at a different coalition setting, where we're also offering them the flu shots when we're doing those sessions as well. So literally, we are putting flu shots in areas that don't traditionally have someone or a doctor's office that's going to be available to give them vaccinations. And we're offering them there for at no cost to anyone that does not have insurance. They can come and get the flu shots. And even if there's a lady that brings a man to a prostate screening, she's also eligible and able to get those flu shots. So we've seen some families come in that way. We've seen some other individuals that are just caring about the people in their family come in and getting their flu shots done. So it's been a very successful campaign for us. We have one more scheduled for January because we do realize that, flu season continues throughout the winter. So we want to have one more session where we're still pushing and we're still advocating in all of those churches for people to get vaccinated and giving them materials and information that they need in order to push vaccinations for their congregations.
Awesome. Thank you so much. Okay, sounds good. I have a few questions, but I'm going to put a pin in it while I let the others share about their experiences as well. Miss Phyllis, you want to tell us a little bit about your efforts at the Sanctuary at Kingdom Square?
Yes. I would like to say I have passed out information to the congregation. Every Sunday, I have an event table set up where I can provide information. I also have vaccine clinic signups on each Sunday to encourage people to get their shots. I have also had in the church announcements, I put a flyer in there to inform the congregation, and my bishop will back up that because he lets them know that you're in church. We have others around. You got to protect everybody. You have to get your shot. So hearing it from the bishop is very good from the pulpit. That really encourage the members to come to my table to sign up. I have partnered with Giant Pharmacy, and I had a vaccine clinic in September, October, and November. They offered the COVID, the flu, the RSV, and the pre-pneumonia shot and the shingles shot. So a lot of people got pretty much all those shots.
Okay.
A few people are very scared of the flu shot. So, because it does make a lot of people sick, like they have the flu. So that's a really hard one to push for individuals when they have experienced that. So that's where the negative piece for the flu shot is for me in working with others. The other thing that I did that helps encourage people to get the shot is incentives. I did offer incentives. I partnered with a couple of senior facilities, and I offered them incentives, $10 gift card to Dollar Tree. You sign up to get your vaccine shot. And believe me, they were willing to do that. They were excited that they were getting the cards. And in one senior facility, I had to provide transportation out of grant funds to pick the seniors up to bring them to the vaccine clinic. So it's things that we have to do to help them. And I always remember that when we advocate, I've always been an advocate, because you're an advocate, when you speak to people and do what you can to help others. So that's what I have
Thank
to
you,
say.
Phyllis. Thank you.
Thank you.
I think. Miss Vivian, over to you. What are you all doing at South Carolina?
Well, South Carolina is traditionally at the bottom of all. We are constantly addressing health disparities and flu and COVID and all of those things. The only thing that saves us from dead bottom is Mississippi. And so we have a problem that's unique because of where we are in the South and lack of access, lack of education. So we try to host our vaccine events on with other events. We also partner with national partners that address other health disparities. And at all of those other events, we always include vaccines, and Walgreens has been a intricate part of that. Without the partnership through the Faith Health Alliance with Walgreens, we couldn't have tacked these vaccines on to other events that we have. And when they come out, they do the flu, the COVID, the RSV, shingles, tetanus, and pneumonia. So they address a lot of upper respiratory things. We also are fortunate enough to have a uh, reputation from our last year's work with the National Minority Equality Forum Faith Health Alliance. So people know that our events are fun. They know that they're well coordinated. They know that. So we have a trusted voice for bringing health information from past work. So we lean in on that because the past year through the South Carolina partnership of community partners with Ms. Sheila, we were able to give incentives to every single person that got a vaccine. And so to address that, now when we partner with these other health disparities, they help with, because we also usually always have a luncheon or dinner or box lunch or something. So they help with us bringing in those subject matter experts, the speakers on the other health disparities, where we can add the vaccines on as a add-on. And they help with the incentives. So we move from giving every person an incentive to every person that registers or comes in gets a raffle ticket. And so that is with budget issues where we don't have to a $20 card. What we do is that every half hour, on the half hour and on the hour, we do a raffle.
Okay. Oh man, your technology is messing you up, Ms. Vivian.
About to leave or tired. So even
maybe you want to take up your video. Let's
they
see.
leave, they know that and there's one at 3:30, there's one at 4 o'clock, there's one at 4:30. So they know even if they have to run and do something, be back by 4:30 because that's the next raffle. I run and go someplace else, be back by 5 o'clock because that's the next raffle. And so that's really helped in addressing and being able to pivot without the money of having, and people just coming for the incentives. Now they're starting to get education. Now they're trying, they know to bring their other friends. The only challenge that we're really having still is the uptake of vaccines for children and getting parents and caregivers, comfortable with the vaccines and getting those vaccines done. But other than that, we have turned the people that come to our events into advocates because they go away with, oh, you should have been there. Oh, you missed it. There was a great speaker. Oh, I won this. Oh, the food was great. And so it has to be a multifaceted approach to get people and to keep people engaged when especially when you're dealing with marginalized communities, when they're worrying about the lights being cut off, worrying about maybe getting evicted, or they might be homeless that we're targeting. They have so many other social determinants of health that they're facing. To that time when they're there, they can just concentrate on being there, getting their vaccine, having a good time. We include music, as you know, music is a great communicator, bringing people together. When you add music and food and a raffle and a subject matter expert, then the word starts to spread, because our events are open to the whole community from all over the city. But one of the key components is tacking them on to every single thing we have. Every single thing we have, you know, even into the Sunday morning, having a health announcements that's a part of our announcements every Sunday. There's a health message about vaccines, about precaution, wearing your mask now, doing whatever it is. But to make sure that you incorporate this information at every touch point that you come in contact with.
Absolutely. Thank you so much, Ms. Vivian. So I'm hearing some common threads. I'm hearing consistency. I'm hearing incentives. I'm hearing education, right? That's awesome. And if there's also something else I heard, it's that three of you are a church. And so if there's someone on the call who's wondering why churches, that's because Miss Carrie, Miss Vivian, and Miss Phil is a part of the SHC's Faith Health Alliance. And the Faith Health Alliance is a community of mostly Black churches who serve as health educators, health, and bring health awareness to their churches and their communities. And now, more recently, are bringing access more and more to those communities through things like flu vaccines, screenings, and all that. Shantia, if you could please put the link in the chat so anyone who has questions or anyone can learn more about the Faith Health Alliance. All right, so Ms. Vivian, you said something that I think Ms. Phyllis talked about. You talked about sometimes you're offering all this education, you're offering all this great information, but there's still people who have reservations, right? For whatever reasons. Are there ways to effectively promote vaccine communities of color despite respecting autonomy? So people's views, how would you do that?
Well, you know, the definition of community has changed. And so the one staple that is consistent in the Black community is the church. So utilizing the church and the church pastor, the leadership first has to be on board. They have to be sold out for the idea. And so getting them, and also acknowledging when you do talk with people that we do have historic reasons for our hesitancy, that you don't pretend that the elephant in the room, that we have not had been mistreated by the medical community in this country. And so you acknowledge that, but you also say, but just because you know that these things, throw the baby out with the bath water. And so you have to, and then and talking with leadership and talking with people that make decisions, especially political leaders and stuff like that. One of the things going forward, and I may be jumping ahead in the question, that we have to be cognizant of is that we make sure that we collect enough data to support the science and what we're saying when we talk to people that are in positions of making decisions around our health. And then when you're talking to the layperson on the street, using a trusted voice, someone that is known in the community, someone that they trust. And so what we try to do is that if you get someone that is at your vaccine site who is getting vaccinated and may have somebody with them, may have the children, but when you see that this person is what we call a early adapter in public health and they are doing it, then you target that person, an advocate, and they can start advocating just with their family and their social network and their friends. And as you build this person's skill set and their information level, then they can spread it to other people. We also use local radio and TV people that it's easy to get on local stations. That if you have that type of connections, if you don't build that type of relationship and you let that be an avenue for getting the information out, and consistency and repetition, it doesn't always sink in the first time. You just got to keep at it and keep at it and keep at it. And sooner or later, you might not convince everybody, but the few or the ones that you do, then you let them become part of your efforts.
I love that. I love that. So I heard you first say to acknowledge the person's reasons, or the respect and acknowledge the person's reasons for resisting or being hesitant. And then you consistently and through different methods educate them and continue to promote the fact that the message you're putting out there is important. And if necessary, even provide data to support the work that we're doing. I love that. Thank
But
you
you
so much.
have to affirm first. You have to give
You to
affirmation.
affirm first.
You lead from a point of affirming these persons' feelings and thoughts and those
Absolutely.
types of things.
Absolutely.
And asking questions. Now, yeah, that. Then how, let's dig deeper into that.
Okay.
Yeah.
Okay. I love that. Thank you.
Mm.
Miss
And
Phyllis.
Chinny, I would like to add that as far as the education and helping those, they ask questions on what type of, I'm sorry about the background, what type of COVID shots do they have? Uh, we have to be able to provide that information, because a lot of times, if we can't tell them what's the latest vaccine called or what do you recommend? I don't recommend, but I do inform you of what shots are provided, Moderna or Pfizer. Um, and they want to know, even with that, which one is the best one. Well, if you can't tell me which one's the best one, maybe I shouldn't do it. So it's having combo and educating all at the same time, because it's actually 7 types of vaccines.
Yeah.
So
Yeah.
that's something else that I help with.
Yeah.
Okay. So
Also
educate
having that information.
yourself and being
Also use humor sometime when they ask me that, and I'll ask them, okay, now what's in that Coca-Cola you drink? So you try to deflect it, because I don't try to go down the rabbit hole of being scientific,
yeah.
because some people are waiting for you to make that one wrong statement, that one wrong mistake. So I try not to get in the weeds of the science of trying to
Exactly. We're
Yeah.
not the
that's
specialists.
not my field. That's
That's
right.
not our
Yeah.
area.
Yeah.
That is
Yeah.
smart.
Because yeah, yeah.
That is smart. Thank you, Miss Vivian. Miss Carrie, did you have something to add before we go to the next question?
I think that they covered it pretty well. And I often will defer to the practitioner that is there that's giving the vaccine to give out that type of information versus me trying to give out that information.
The rabbit hole. Smart. I love it. I love it. Okay. Miss Phyllis, tell us, how would we engage marginalized communities that are often left out of public messaging? Are there specific things in your work that you've seen that folks are drawn to, will be more helpful when we create messaging, wording around vaccines, whatever kind of vaccines? You're on mute.
Yeah, I would say vaccine education is really very important, because people need to be aware of the information so they can make an accurate decision about vaccination if that's what they want to do. Um, in working with the communities, I recommend a lot of communities have what you call um, HOAs in the developments. And I partner with them because a lot of the information and emails that are blasted out to the development encourage them. And when they have meetings, go there so we can provide information. So that these developments have 3, 4, 500 people or more. So that's an area that I work with. Also working with the health department. A lot of the low income individuals in our communities is through the Department of Social Services and the Department of Health within the counties that they live in. So I work with them as well, because that helps those individuals right on that level, because a lot of them do not even have insurance. Now, I have helped some individuals in the communities that do not have insurance. One thing, COVID cost $100 some, but the flu shot was like $39 with Giant. So I end up paying for a few people to get the flu shot, because that's how important it is to get it done. So that's kind of like what I see in working and informing the community. So that's all about public health.
Thank you very much. Miss
Thank
Carrie,
you.
how about you? Are there specific groups you work with or specific messaging you think that is important as we target, especially marginalized communities on vaccinations?
Yes. So for us, it's again getting that pastor in front of you. Again, a lot of the commercialization, a lot of the marketing that you see are not people who are Black and brown. And so being able to talk to those congregations that are majority minority populations, and hearing it from that trusted voice is how you get people to get outside of that box. My pastor, Pastor Daniel Simmons, will actually tell you that he was even hesitant about getting the flu shot. And so it's through the efforts of education and them constantly hearing it, seeing it, it's constantly available to them from people who look like them. That makes the difference. That makes the difference of whether or not you will make the decision to go ahead and get that flu shot done. So again, putting the information out there from someone that looks like or you can relate to is very important to get the people in the room that normally wouldn't be in the room.
So sometimes it may not necessarily be a fancy ad. It may not necessarily be
Right.
just somebody they can relate to, somebody they can trust.
Absolutely.
Okay, Miss
Yeah,
Vivian.
Yes.
but I'd add on to that, like she said, in getting the information out there. What I found with getting information out there to unsupported, marginalized communities is that they're very visual. And if you're putting something out there, particularly in print or posting stuff, is that you don't make it look like a public service announcement that came from the health department. They don't read it. They don't, pictures do more than a lot of words, and also, like and said, and colors and things of that nature that attract the communities that we are targeting, which are Black communities. Like if you notice when I noticed right away the artwork on the wall behind in the lobby there,
Yeah.
behind Miss Phyllis. That could have been a get a vaccine. Could have been at the bottom of that picture because I'd already gravitated toward it. Even backgrounds around everybody else, the artwork and the visuals of what was behind her drew me. And I learned that does that with marginalized communities and with communities of color and other ethnicities, Hispanic communities, Asian communities, communities that have a lot of flavor and color in their customs, African communities, they have those types of things in their kente cloth, African proverbs on a poster, a man who hides his disease cannot be cured, expect to be cured. I put on everything, and just you have to have a brief second to catch a person's attention, and to make them want to take that fire home. You want to make them want to keep. And so making it look like a public service announcement has been very useful and been critical in making people pay attention when we do post things.
Okay. So I'm hearing understanding your community enough to be able to know how to message quickly and effectively. I love it. Okay. Okay.
Yeah, because you're not going to read that whole 10 bullets on how you do it, how you don't. How you get it, how you don't. You got a poster with 10 bullets in the health department logo on both sides. And they're going to walk right past.
Okay. Okay. All right. That's great to hear.
Yeah.
Yep. Yep. All right, so now let's talk about how advocacy intersects with public health in other public health initiatives, advocacy for vaccines, and how it intersects with other public health initiatives. I already heard you talk about how you incorporate your vaccines with other screenings, right? And other events that are already scheduled. Why is that important? Especially in today's in the political atmosphere where we are, especially in now with so much going on with regards to pricing, people having to cut one thing out or the other. Why is it very important that we continue to intersect this messaging, these events around other public health initiatives?
Well, first of all, the communities that we are charged to target have all these other health disparities and initiatives. So when you combine them all and you start to bring health messages in I call it in a bouquet, where you hand them a bouquet full of useful information about different health disparities. And also as you incorporate them into other, like we just had our World AIDS Day event, where we also had a opportunity for vaccines and stuff, is that you destigmatize different health disparities. And so, back in my day, back in the day, they called cancer the big C. It had a stigma to it. COVID came with and also within the African American community, we've been stigmatized and had so many labels to a lot of times we're not ready to accept another one. Us too again. So you're like, oh, okay, enough already. So instead of coming with every single time with another individual health issue and disparity, to combine, and you get more bang for your buck, and you get once you have a captive audience, hit them with both back. If you're talking about HIV, tell them how COVID impacts people with HIV. If you're talking about cancer, you talk about how any person with a a pre-existing is at risk for flu and COVID death. And so that's where I make the intersection, that because of these other health disparities, you do not need to be one to get the flu or COVID. You need to be vaccinated. Anyone you know who has a pre-existing condition or another health condition, morbidity, a comorbidity, needs to be vaccinated for flu and COVID. And so that's how you message them all together.
Okay.
I think she hit the nail on the head with a captive audience. Once you have a person that's already right there in front of you, there is no reason not to offer the vaccination. There's no reason for you not to have it available for them because they're already there. They've already taken the time. And that's the biggest commodity that they have is their time. So while they're there, let's give them as much information, as much possibilities, as much options as possible in that one setting so that they don't have to come back again.
Awesome. Awesome. Okay, Miss Phyllis, I heard you say yes. Yes.
Yeah, one thing that I wanted to add to that, what she's saying, is that when I have event table each Sunday, I provide information on various chronic diseases. And when I put that information out there, I do just what she says, add the COVID and flu shot to that. Because if you get sick, it's going to affect your health. Your immune system is going to go down even more. And sometimes they'll say, oh, really? Oh, maybe I should. And I said, talk to your doctor. Yes, you should. It's very important to get your vaccination shots. So I'm in agreement with her. That's basically what we have to do because we have to tie it to all the chronic diseases that's out here.
Okay.
And when I get people to come and speak on different kind of diseases where I add the vaccines in it, it's also important that you bring people that look like them.
Right.
Yeah.
They listen better. Yeah.
Very true. All right. We hope you're still out there listening to us. We're still talking about ways to continue to promote vaccinations by increasing public awareness, understanding, and acceptance so that folks are willing to take the vaccines, especially in communities of color where we serve. So speaking about educating, advocating, increasing public awareness, do schools play a role? Ms. Vivian talked about the fact that, a lot of people are still unwilling to vaccinate their kids. Is there a role that schools play, and how can we in community, in the churches, work with the schools to support this advocacy issue? Can we, I don't know, what are some ways that you think would help, or some ways that you have worked in the school settings that helped?
Well, this is Phyllis, and I would like to say, first of all, the schools need to teach the kids how important it is to get the shot, because we explain to them that they can get sick, and explaining to them about being sick and they don't want to get sick, they will talk to their parents, because some have done that, because the parents have communicated back and said, well, I didn't think about it, but my child really wants to get the shot. It changed the parents' mind because the child is so concerned by being in school, and then how they can affect other kids and how other kids can affect them and make them sick and you can't come to school. So it's the encouragement there that the school can do to help.
Okay.
And some schools still have it that they require vaccines and you're not allowed to come in school for
Okay.
your child. So,
Yeah, there are other vaccines that are required to go to school. I think the COVID should be added on to on
exactly.
yes. And then like Phyllis was saying about using the students and educating them to talk to their parents, but also vice versa. Schools have PTOs, and that because no matter how adapt a student might be to wanting a vaccine, the parental permission still has to be given. So by talking with parents at PTOs and having like at PTO meetings, like it's a couple of schools that I've worked with, I've made a relationship. I've gotten friendly. I take cookies to the school nurses and then talk to the school nurse. And with one school, no, it's at two schools, I've convinced the school nurse to go to PTO meetings. School nurse talks at the PTO meetings to the parents because the parents have the final decision. The children aren't of age to give consent, and so that works.
Okay.
And
Okay.
I would just want to put one quick plug in actually for Georgia Public Health on this one, because one of the partnerships that we do have with the school systems is that they work directly with public health to have vaccination clinics in the schools. So literally the paperwork goes home to the parents are able to sign off and say, yes, my child can get a shot at school, whatever day they're having the vaccination clinic, and that parent doesn't have to worry about taking that child to an appointment in order for them to get the vaccination. So that's kind of, we've kind of deferred to public health in that regards, because they're doing a pretty good job to have those vaccination clinics during school hours so that their parents don't have to pull the children to go take them to get a flu shot.
Oh, that's a
Okay.
great idea.
Yeah, that's
Yeah.
great. That's great. I know they do that in Maryland as well.
Yeah.
Because you can't take off from work to go get a vaccine.
Right.
That's why you can't do your vaccine clinics at 10 from 10 to 12 on Tuesday.
Right. That only works for a very small segment of your population.
Yeah, if you're not
Right.
ready to put in those unconventional hours, then
Right.
you're not going to reach the people that most need reaching. If you're not
I agree with that.
going to do it after 5 o'clock, or if you're not going to do a weekend, then you're going to miss the ones that really need or ones that don't have access.
So is
We
it
talked about that time being the commodity that we're talking about. So even when you're doing it on a Saturday, even when you're doing it in the afternoon, you're still competing. So you're competing against sporting events, you're competing against other activities that people are involved in. So you have to have something that's going to draw them to your event.
That's true.
Yeah. So
You're right.
So that's why those incentives are so important.
Music,
That's why I
food,
do 'em.
incentives.
Yeah.
That's how
Yeah.
I combine the threes.
Yeah. So is it fair to say, from what I'm hearing from all of you, that having the vaccines having the option to take the vaccines at different places, working in different non-conventional places, like Ms. Vivian said, working with the school nurse to show up at the PTO meeting to educate the parents, and the public health department to make sure that vaccine hours and vaccines for kids at school, and to educate even the students themselves, like Ms. Phyllis said, so at different sectors, the different sectors working together, so that at every point people are hearing this message consistently from different people, so that if they're not in church on Sunday, maybe they hear it in school at the school PTO meeting, or they get a text saying, hey, we have vaccine hours, and they're able to get it. Fair enough, right?
Right.
Yeah.
And then the more they hear it, the more likely they are to actually act on it. So, yeah.
But you know what I just thought about we might could do? The little round things that when you go in the voting post on your I voted, we could have I got vaccinated.
Yeah.
You get your little sticker, you get your I voted sticker. Maybe you need to get your I vaccinated sticker. And it might let you know who's not vaccinated also.
And not
So
just that though, it also
say that church hug.
Yeah,
You do
not
that
just
church
that.
hug.
Not just that, you could actually also start a conversation. So
Yes.
asking it, you could start maybe, oh, you got vaccinated, now we're wearing badges, and then that could lead to, have you got vaccinated?
Because I'd be looking for the I vote on
the election
yeah.
season, right?
Yeah, I've already people say you voted. I do like this.
Yeah.
Yeah, that's a great idea.
Okay.
Mhm.
All right, so let's talk about something a little different, but I tell you, very interesting. Let's talk about measures to combat politicization of vaccines. How do we do this so that we keep our focus on the science and the public health benefits of vaccines? How do we do it in our communities? How do we continue to make sure that vaccines don't they don't continue to be an issue for politicization? And because we know that turns some people off too. So how can we continue to stay on the scientific and public health benefits of vaccines?
Data.
Well, this is Phyllis, and I'll start while it's quiet in the background. First of all, we have to build trust with each person. We also need to find out what their needs are, what challenges are they having to make them hesitate in getting these shots. A lot of times I'll do, say, a flu shot survey and just survey people. Yes, no, did you get the shot? If you didn't, why not? To get ideas and what that challenge is. So that's something that we can do and work on to, again, the key word, encourage.
This was one of my soapbox during the COVID pandemic, because your health is not political. And it shouldn't be political. Your health is your health, and your health is where you are able to provide for others that are around you. So your health has absolutely nothing to do with politics. While funding has a lot to do with politics, your health does not. So I always try to explain to people the difference between this is political and this is your health and well-being and your ability to help people in your family because you don't want to be sick. So vaccination has absolutely nothing to do with politics, but it has everything to do with how you are able to survive and help your family.
Okay, Ms. Vivian.
And we can also use like on what Carrie said, you know, your health is not politicized, but it is. It has become a political issue. And like doing that, like 2 years of experience.
I agree.
And during the HIV epidemic, what we did was we took county by county, city by city, and we got we analyzed the data, which is already collected. It's housed somewhere in your state. There's a record of all hospital, emergency room, EMS, all data. And what we did was we put $1 to what it was costing each county in people out of treatment and care, where people are showing up at emergency room, people having to call ambulance, people being in the hospital. You can do the same thing with COVID, and you do an economic impact of what it costs your little poor county hospital. And we took that to the state house to each representative. Now they were waiting. We used to take people up there by telling you the story. Oh, everybody, you know, needs to get the flu. We need to protect the community. Tell you them politicians didn't. Oh, okay, they listened to us. Yeah. But when we took that economic, this is what it's costing you. You don't want your people vaccinated? This is how many people your county had in the hospital. This is how many people your county had on a respirator. This is how many people your county had died, that families now have a loss of income. And this is what it's costing your economic community, which is already socially, economically impacted. When you talk dollars and cents to, since we're on the political question, to people who making decisions about whether or not free vaccinations will still be available, but the access to treatment will still be available, you have to take them economic impact data.
Okay, I like that. So let me ask you, we've heard all these things that you all have said, how important it is to put the message out consistently through trusted voices, through everybody in the community, so non-traditional areas, partnering with non-traditional spaces to get this word out there consistently. And now Ms. Vivian saying using numbers to show how much of a benefit it is, using dollars and cents, right? So somebody has sat down and listened to all of this, and the person says, okay, so how do I start? Where do I start? I'd like to do this work. I don't belong in a church where I'd be able to say I can work with my wellness community. Do I have to be in a church? Can anybody be an advocate? And how does the person start?
Anybody can. Anybody can. You're advocating when you're talking to your friend or your sister or the lady sitting next to you on the bus, that you when people that are totally not about public health at all as far as experience, I just tell them that in every opportunity, if you could tell your story, if you can bring up that, I just got vaccinated. If each one, teaches one, each one tells somebody else about their experience about what they did, then you start to be an advocate. And then you start to educate. And then I tell advocates, it's very important that you get as much information as you can, because misinformation is as dangerous as no information. And misinformation will travel quicker than no information or right information. But everybody can be an advocate, and everybody advocates for something. If you like chocolate cake more than any other type of cake, you talk about it when
Right.
the subject of dessert comes up. Any opportunity you have to, when a health subject come up, then you use that opportunity to do no more than say, "Well, I already got my vaccination." You know.
And you know what? And what I want to add to what Vivian's saying, everybody does have advocacy skills, because advocacy skills is communication. It is
Yes.
networking with one another. It's
Yes.
it's research. It's teamwork. And we do all that. So it's skills that we already have. We just have to use our skills a little bit more. Some people are shy, low
Team.
key, but we have to be an advocate, a strong advocate. And one thing I can say about being an advocate is you connecting, you're communicating, and when we talk with one another and go with issues on this and that, we are collaborating with one another. So those are all the skills in being a part of being an advocate. Thank you.
Thank you so much.
And a real help in being an advocate too is using people that have lived experience in what you're advocating for. Like a lived experience as part, like that's the storytelling part. The live experiencing, not, I'm not telling you what I heard, I'm telling you what I know type of person.
And I think just people understanding that everyone can serve as an advocate. Like, you don't have to have any special training. Like, again, if you've lived
Right.
the experience and you have the ability to go and talk to anyone about what your experience was and why you feel that it's important. And you do that within your area of influence. So wherever that is, you can have a conversation with two of your friends about what advocacy is, why it matters,
Right.
and why they should go out and do it in their communities and in their circles.
And also to add to that, parents are advocates for their children.
Always.
Always.
Mm-hmm.
So when they even talk to parents, that's what I tell them. You're doing that, and I'm doing that to encourage you to get the vaccination for you and your kids. And they kind of like, oh, okay, I see what you're saying. So we just, like you say, you just turn the table.
Right. And even back to the point about going to educate the students, I can't tell you how many times my children have come home with information that I didn't have or that I didn't know. And they've come home and told me, well, we should do this or we should try that. And it'll at least put me in a part of mind to say, well, let me go and do some research on what they're talking about. Let me see if this is something that I actually do want to pursue. So educating the children is an absolute great way to start an advocate at a very young age.
That's right. That's right. All right. We're almost at time to wrap up. I'd like to give each of you an opportunity to call out in the spirit of NIVW, National Influenza Vaccine Week. I'd like to give each of you an opportunity to close out with one final word. I'm hoping it will be something that motivates, something that encourages, something that makes someone get up and do some advocacy work today and get other people getting the flu vaccine. So who would like to start?
I'll start. I'm gonna close out because I do have something. But I told you, Chinnie, this time was gonna go fast.
Yes, it did. It sure did.
I'll close out with the simple words from the Faith Health Alliance and from Laura Lay. Don't wait, vaccinate.
Thank you.
I'm gonna go with Sankofa. Reach back, pet somebody else, and pull them up with you.
That's right. I love it, Miss Phyllis.
And I say boo to the flu. Don't let it get you.
Yeah, say boo to the flu. I love it.
Don't let it get you.
Yeah, don't let it get you. Don't let it get you. Thank you so much, ladies, for today. And thank you, everyone who was able to join us on the call today. We hope that you learned something. We hope that if you haven't already, that you're inspired now to go out and get the flu vaccine. Again, we're wrapping up flu vaccine week, but we would be remiss if we did not talk about other vaccines. They're equally as important. So get yourself protected against vaccine preventable diseases. If you're not sure where to start, please send us an email at shc@nmqf.org. We'll work with you to find someone where you can get vaccinated. Hopefully, there's a local Walgreens to you where you can get vaccinated, or that you can even work with them to plan an event. I see Brendan on. Can I pass it off to you?
Sure. Now, yeah, just thank you all for the great advice and the information. Really appreciate you. Appreciate SHC as always putting the thoughtful webinars together. And I guess that's it, everybody. Hope you have a great weekend.
Yes. Thank you so much for joining us.
Thank you all. Glad to be a part of it.
All right. Thank Team Trinity.
Have a
and
blessed weekend.
Thank
Anderson.
you.